Good morning, everyone. This is Melissa Andrews with LeadingAge Virginia. Welcome to our weekly call. Paula, you want to put the next slide up, please? Thomas Gates, are you on the phone or are you with us to give the overview of the CARES Act funding as we planned? You probably have to unmute yourself. Thomas, are you with us? We will give it a moment. Well, this is unfortunate. Thomas Gates from DMAS, are you on the phone? Well, he was our one and only speaker today. In the daily update yesterday, the first item was about the funding for nursing homes and assisted living and an overview. Since Thomas has not joined us, oh, Paula just emailed him, so we'll give it one more minute. Sorry about that, folks. I will be including these slides in the daily update today as well.
Thomas, you'll have to unmute yourself. Try *6 if you're on the phone.
Okay, sorry about that.
Oh, there you are. Fabulous. Welcome, Thomas.
Hey, sorry guys.
That's okay, guys. All on pins and needles, but the floor is yours.
Sorry, I had some GoToMeeting challenges. I thought I had all of the different web things downloaded at this point, but apparently I haven't used GoToMeeting yet. So apologies for that.
No worries. We're glad you're here. Thanks so much.
Of course. So just wanted to take a moment. I've only got a couple of slides and just a few things to say. But we did want to provide a little bit of an insight on where we are with the additional payments that we will be making utilizing the CARES Act funding the federal government has provided to Virginia. One of the targeted things that the governor has allocated that funding for is additional support for nursing facilities and assisted living facilities. And so we just want to kind of walk through where we are in the process of setting that up, what the general outline is so far, and kind of when you should expect more details. We are kind of in, we have a pretty good sense of the program design. We do not have 100% of the details of how reimbursement will work. All of that is still a little bit to be figured out. So kind of bear with us a little bit here. So the first slide here is really just to explain kind of what is eligible and how we're going to calculate this. So we are allocating $4,000 for each, and this is assisted living facility specific. There's a slightly different formula for the nursing facilities. We're allocating $4,000 each for each assisted living facility for each month. So this program runs July, August, September, and October. And each living facility assisted living facility will get $4,000 a month. Now it's important to know this isn't it's not a rate. It's not a automatic payment. It's instead how we're going to calculate kind of the maximum payment. So in addition to that $4,000 each month, if you are a facility that has folks who are auxiliary grant recipients, then that will also add to that kind of cap of what you can be reimbursed for. So for each AG resident per day, you get an additional $15. So essentially, we will calculate a cap for each month based on the $4,000 plus however many AG residents you have times the number of days those residents were living in your facility, and that will give us kind of the maximum payment you could get. You still will have to demonstrate that you incurred COVID-19 related costs up to that maximum and present that to, we're bringing on a vendor to help with this. Basically, DMAS doesn't have the capacity to take on this invoicing process, which is why we're getting some administrative support to help us out. I'm hoping that contract will actually be signed today. And so that will help us kind of kick off the next round, which we'll get a little bit into in the next 2 slides of what the timeline is. If that contract gets signed today, that'll help us kind of kick off the next phase of this. So then, yeah, the funding can be used for testing, staffing, PPE, cleaning supplies. You really just have to link it to COVID-19 costs. One of the questions I got in an earlier presentation about this is, do you have to have an existing COVID-19 outbreak or residents who have COVID-19 to receive this funding? And the answer to that is no. This is really designed to, we are aware you guys are doing proactive things to prevent that from happening and incurring costs that are related to COVID-19, even if you don't have a specific COVID-19 outbreak. So you do have to capture those costs. You do have to present that in an invoice. Details TBD on exactly what that will look like. But as we're already in the window where you can be incurring these costs, just make sure you're tracking, keeping some documentation on what kind of costs you're incurring for things like staffing, PPE, cleaning supplies. And when I say staffing, obviously that's something where, are you having to authorize overtime pay for, cleaning staff? Are you bringing in additional folks to do cleaning? Are you changing your processes in some way that's related to COVID-19 that's causing additional staffing? That's kind of what we're thinking there. It wouldn't be just your base staffing cost, but it still has to be connected to COVID-19. So if we can go to the next slide, walk through a little bit of the schedule. And again, this is subject to some change. We're moving as quickly as we can, but we're having to kind of set this thing up on the fly. So July 1 is the start of the eligible costs. So this part of the schedule is driven really by the CARES Act requirements from the federal government. We have to have all of the payments made by December 30th, or all the costs incurred by December 30th. So we're setting this up to start in July 1 and end at the end of October. So starting July 1, any costs that you have incurred that are related to COVID-19, you can build into what you're going to invoice for. As it says, the week of July 27th, we're going to bring on our administrative support contract. Like I said, I hope that happens today. The contract is kind of winding its way through approvals at the moment, but definitely this week. In early August, basically, we're going to hit the ground running with them as soon as we get them on board, and we're going to work together to get some communications to send out. I believe DSS is already working on sending some stuff out on this, but we will send something out. Probably it will come from DMAS as opposed to the vendor, but we're leaving it open there. Basically just explaining exactly what you will need to do to both enroll as a vendor with DMAS and also what documentation will be necessary for invoicing us. The enrollment process is basically because assisted living facilities are not current Medicaid providers, we don't have any way to pay you. So we will have to enroll you as a vendor, basically, and get your electronic funds transfer information. That will all be done by DMAS staff. So we'll have some information in our communication in early August on what you need to do there. So we will get you enrolled as a vendor. We will get you exactly what kind of forms you need to fill out, what kind of documentation you need to provide for those invoices. And then in mid-August, we will start actually accepting those invoices and start processing those. So again, like I said before, you'll have to document, and the language here is a little bit It includes this $20 per diem. That's really about nursing facilities. Also, we're aware, assisted living facilities are not receiving provider relief funds. So again, that's more about the nursing facilities. But you'll have to document that it was a COVID-19 related cost, and then we will then calculate that cap, and anything up to that cap we will be able to pay. Going to the next slide. In late August, early September, we'll start actually making those payments. The way our process works, there's usually, we'll have about 2 weeks of rolling as our plan to have a rolling basis where we're getting those invoices in and we're making payments kind of every 2 weeks. And again, the payments will come from DMAS itself, and we'll pay you as a vendor. The eligible costs end October 31. So in that sort of needing to document what your expenses were, you can document costs up to October 31, and then that's kind of the end of this program. So any costs you incur on November 1, we couldn't reimburse you for. Final documentation will be due December 1. And then the U.S. Treasury has updated their guidance in the last week or so, and they are now making it sound like we could make payments after December 30, but all the kind of costs have to be incurred by December 30. We are reserving kind of the option that we may have that final payment slide into January if we need to. The goal is still to make it in December, but we are still kind of evaluating with the vendor exactly what the invoice review process is like. Obviously, we need to ensure that these costs are related to COVID-19. We don't want, we're aware from news reports that the Treasury Inspector General will be, looking at all these things. So we want to make sure we have a kind of robust process that's reviewing those invoices, validating these are eligible costs under the CARES Act and this program, and making those payments. So that's why we added that early January there. The goal is still to make those payments by the end of December. But we just wanted to kind of leave open if the invoice review process takes a little longer to ensure kind of accuracy and validating that they're eligible costs. We wanted to kind of reserve that right to make that final payment a little later. So with that, that's sort of the broad strokes of how we're going to calculate the cap per facility, what kind of costs are eligible for this, and then a basic structure of when you should be hearing more from us, and when you can start expecting to be enrolling and sending us invoices. So with that, I would be happy to take questions. If I can't give you an answer today, I'll be happy to take it back and confer with either my colleagues at DMAS, the governor's office, DSS, wherever.
Great. Well, thank you, Thomas. A couple questions have come in. The first is, will private pay assisted living facilities be eligible?
Yes. So that's a great question. So this program, while DMAS is managing it and kind of we're the vehicle that the Commonwealth has chosen to run this program, it is technically not Medicaid. This is not a Medicaid program. This is funded by the CARES Act. We're actually, as we're trying to ensure that this is separated and tracked separately for the purposes of these federal programs, even though nursing facilities are Medicaid providers, we will probably be re-enrolling them separately for this program as just vendors to pay them. So this CARES Act money is really in its own bucket. So yes, private assisted living facilities are eligible. Again, that cap is calculated based on the $4,000 per facility, and then the AG recipients are kind of increase what that cap is. So if you're participating in that program, you have residents who are participating in that program, that will increase the kind of maximum reimbursement that you can get. But the 4,000 is for, I think the number, is for all of the assisted living facilities in the Commonwealth.
And so what will the follow-up question is, what is the reimbursement rate for private pay nursing facilities?
So again, it's not a, we're reimbursing based on your actual expenses. So and in fact, reimbursement may not even be the right term because that has such a specific meaning in medical payments and Medicaid. So we might want to come up with something different. But really, what we're saying is you document your allowable COVID-19 related expenses. We will calculate a per facility cap on how much of that we can pay. You demonstrate that you have expenses up to that cap or higher than that cap, and we will pay you for those expenses. So there's not a rate. It's not a, even for the AG recipients, it's not like you get $15 per day. It's just increasing what you could be reimbursed if you have eligible expenses that come up to that level.
Okay. Okay. So you document your allowable COVID-19 expenses. DMAS will determine the cap, and then you'll be paid based on that cap?
Yeah, so just for like a back of the envelope example, you say you do not have any AG recipients, so you get $4,000 per month. You demonstrate that you had an additional, $5,000 in cleaning costs alone. I don't know if that's likely or not, but you would then show us that in your documentation. We have this COVID-19 related cost that exceeds the $4,000 cap for this facility because they have no AG recipients. We would then pay up to that cap. So we would give you $4,000.
Okay. Okay. Follow-up question. Will this information be posted on the DMAS website along with eligible allowable costs and submission requirements?
That's actually a good point. We haven't discussed that yet. We will have some public, as we're working with the vendor to actually send out this information, we'll make sure that we're posting it somewhere publicly. We'll have to think about exactly where to post that, just again, because this is sort of a special program that is not technically part of the Medicaid program, but that's a really good point, and we will make sure that it is publicly available somewhere.
And if you send it to Dana, we'll get it out to our members as well.
Absolutely. We will be leveraging you guys for sure on that.
Good, good. Another question came in. Has there been discussion on why the reimbursement period is starting in July versus March?
I think that is, that question has been asked. I know, Steve Ford has asked that question as well on the nursing facility side. I think that's just a, program design as they were looking at, how much money was available for this, how much money, and kind of what we could allocate. They decided to do this 4-month period. They decided to start in July. I think you could have made a different choice there, but that's just how the program was designed.
Okay. Let's see. Other questions? Anybody have any other questions that you either want to speak up or enter in the chat box? We'll give it another minute, Thomas. Thank you so much for this great overview.
Oh, absolutely. And like I said, more to come. We're excited to kind of bring the support on board and start getting some of these documents together to send out, which will have some of that detail that I know everybody wants with, like, exactly how do I document this and exactly what is an allowable cost.
Perfect. Well, thank you so much for being on with us today. We really appreciate it, and we'll look forward to sharing more information as it becomes available. Oh, wait, one more. So another question came in. What is the cap for private pay nursing facilities? I think you kind of addressed
So
that.
again, I'll just say the formula is basically it doesn't matter whether you're private pay or not. It's $4,000 per facility per month, and then an additional $15 per auxiliary grant recipient resident per day. So if you have 2 residents who are there for the whole month, that would be 30 days times 15 times 2 would go on top of your $4,000. If you have none, then it's just the $4,000 per month.
And then for communities who have both private pay assisted living and private pay nursing facility on the same campus, the total cap still 4,000. So basically our retirement members who have multiple levels of care.
Yeah, I think that's I think that's something we'll have to make sure we clarify in the kind of more detailed guidance we put out, exactly like how the per facility cap would be calculated there. But my kind of going in assumption would be that yes, those would be kind of treated separately. But we will make sure that that is clarified in whatever comes up.
Okay, great. Any other questions? We've gotten some good ones in the chat box. I appreciate our members for
Thank you, Chris.
Yeah, right. They're giving you food for thought to take back, right? Okay, well, to my members on the phone, if anything, you think of anything after this call that we need further clarification on, we'll funnel that to you, Thomas, if that's okay.
Absolutely, yeah. And I think my name has been sent out. I'm getting a few questions directly from folks. I think Bill and my name is starting to be shared around. If you do have specific questions, please feel free to come to us. We're trying to move as quickly as we can. We know this is really important for the community. It is obviously standing up a whole new program it takes a little bit of work. So we know people are eager to start getting these reimbursements, and we're working as quickly as we can. I will say there's been a little bit of confusion, I think, on the PPS survey that VDH was doing. Some folks have come back to us directly and asked, they're kind of coming to DMAS to schedule like follow-up surveys and things like that. And just, hopefully it's clear from this presentation, we're not going to be kind of stepping into the role that VDH was playing there in terms of scheduling and stuff like that. We're just going to be reimbursed. If you have kind of costs, if you're doing testing, that's an eligible cost for this program. We wouldn't be kind of approving that on the front end or scheduling that with you. You would just document that as a cost that would be allowable under this program.
It's a great clarification. Thank you for that. Thank you so much for being with us, Thomas. We know how hard you're working on behalf of our members. So we look forward to more information coming out.
Yep. Thank you so much.
Thanks. And that was a good segue. I'm not sure, Thomas was really our only speaker today, but is anybody on the line from VDH that wants to give any kind of update? I don't know that you are, but I thought I'd put it out there, Sarah or any of your team. Okay, different subject has come into the chat box. Yesterday, we received information from LeadingAge National regarding relief funds for private pay assisted living. Yeah, so thanks, Dave, for that question. As a matter of fact, I was just putting something in the daily update. So this is with regards to HHS is considering relief funds for private pay assisted living. The submission for data is due July 31st. However, the actual process for submitting that data has not been finalized yet. So in yesterday's LeadingAge Virginia daily update, we included all of the information that you need to get organized and gather. LeadingAge's update today was that they are testing that submission technology within the next 2 days. No, that wouldn't make sense. They're testing it today. Just realized today is July 29th, and that they should have that out to everybody as soon as possible. I know it is a very tight turnaround. In addition to gathering that information for private pay assisted living, they have also said that private pay nursing homes and adult day providers should be gathering that information. And you're going to send that information, if you're a private pay nursing home or adult day program, you're going to send that directly to Nicole Fallon at LeadingAge National. And so I will put this in the chat box, but it will also be in the daily update that will come out this afternoon. So Dave, I'm sorry, they just haven't released that mechanism yet for submitting the data, but if you get that together, as soon as we hear from them, you'll hear from them and we'll get that out. Another question came in. Are there any updates, guidance regarding the emergency temporary standard that took effect on the 27th? Well, as you all can see, Dana's not here today. Is there anybody on the call that can help us with that? I can look into it, Winoka, of course. I'm trying to remember everything that I've been writing for the updates in the last 2 days. I feel like something was in our update yesterday regarding that, but I might be wrong. Anybody want to help me out?
This is Alicia Cundiff with Spot Spain. What specific updates are they looking for? I know that there are several webinars that are being offered to provide employees with more information on the new standard.
Well, Alicia, nothing else has come in. Winoka, do you have anything more specific? And thank you, Alicia, for being here, helping me out. Oh, okay. Well, Dave Rawlings, he responded and said new standards have been published on the VADOL website. And Winoka said, thank you. Wasn't that nice? Members helping members. Awesome. Okay. Anything else? We had just that one agenda item, but please feel free to put something in the chat box if you need have questions or clarification. All right, doesn't look like anything else has come in. So the update, check yesterday's update, and then today's update will be coming out early today as well. As soon as we find out about that data submission process, we will get that out to you right away. And thank you so much for being here. Thanks for your membership, and I hope you have a great day. Take care, everybody.